You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. According to my first guest, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Dr. Nagrani. Dr. Nagrani, welcome to the program.
Thanks, Al.
Now, before we get into today's topic, and I've got a lot of questions about dental implants, who's a candidate, and the process, your practice, you do a lot of things, more than just dental implants.
Sure.
So tell me the procedures you do and the typical patient that you see.
Okay, as a general dentist, I do all the procedures that dentistry allows me to do. And I say that because we've had patients, I have a laser, so they want me to do some laser hair removal. I don't do that. I will not do that. Okay, so I'm going to limit it to dentistry, and I get to do everything. You know, it's a family practice, so it's families. We see school teachers, tons of them, school children. We see judges, we see lawyers, we see electricians, we see plumbers.
So all types of people.
Oh yeah, we've got a Navy base next door, so we see servicemen's families. All. We see some dentists too.
But for the denture wearers,
okay,
you say that traditional dentures will not exist, possibly in the future.
Possibly. We've got implants there that secure. We've got just maybe 2 over here that is securing. We've got a population of people that have dentures already. Okay, they've lost their teeth, but we can still make their lives better.
You say 2 implants,
2 implants right there.
Out?
It creates so much retention that we see people, when we first load those dentures, but by load I mean engage the implants.
Okay.
They've got to kind of really push out with their thumbs. You know, they got sores on their thumbs over time. That's a good problem. That's the kind of problem I want to see. Not it flying out of when they're laughing.
How big of a problem, by the way, is, you know, I Googled, you know, dentures, and they say 20 million, 30 million people have an upper or lower denture.
Sure.
Do you think that there's, you know, 1,000 people in the Central Valley
more
that maybe have an upper or lower denture?
More.
Really?
Yeah, we see them all the time. You know, and they're resigned to wearing those dentures as is. This is the way dentures are. And there's a kind of a mindset that's been there from 100 years ago that, oh, I'm going to lose my teeth as my parents did, and I'm going to have dentures. No, not at all. That paradigm has shifted. You move on. Yeah, it's 21st century. You're not going to lose your teeth. When you have your teeth, we're going to maintain it. We're going to keep it there. If you have to lose teeth, all your teeth, there's a better solution. Okay, if you have implants already, if you lost your teeth, there's still a better solution.
Okay.
Are you having a problem eating with those? Of course. If you have got a full denture, there's some things you cannot eat. You're limiting your life, your nutrition.
Are dentures miserable for the most part? I mean, do they confide in you, I should say?
Yes. That's chief complaint. The most common complaint of denture wearers is this. It's moving, it's loose, all the time. It gives me sores, adjustment. Because the bone is moving, it's shrinking over time. You're losing that bone. Once you have teeth taken out, the bone starts shrinking. Okay, so you can make the denture, the bone's going here, denture's going to be loose. You got to reline it. Denture's going here. I mean, the bone's going here, denture's getting loose. It's a constant problem. Guess what? You put implants there, the implants hold on to the bone. The bone will not go anywhere. You have a better fit.
So you can give them all denture wearers, like 2 implants, give them a snug fitting, they can eat, they can chew.
At a minimum 2, I recommend 4 a lot of times because it gives you that much more retention.
Okay.
I mean, you know, if someone with a denture tells you he's chewing steak, he's not chewing the steak, he's just pressing it and swallowing it, you know, and that creates different kinds of problems because the body, you know, God gave you a whole set of teeth for a reason, to chew the food. Your body can do it for you. Yeah, your stomach does a little bit of that, but it's counting on your teeth to do most of the chewing. Now, if you're not doing that chewing, the food is not chewed up adequately in your body, and so it's creating digestive problems.
Interesting.
Down the road. I mean, I have a GI buddy. You know, he's a specialist, that he sees this all the time. And he was telling me that, you know, in addition to not being able to chew food, for example, as you get older, you want more fiber in your diet.
Yeah.
Fibrous foods, by nature, are kind of tough. You want to chew
broccoli,
them.
Like broccoli, I guess a denture wearer can't really...
Exactly. You don't want to just mush that. You want to chew that, break that, tear it up. You can't do that adequately with dentures. And so you're not getting that fiber in your system. You get GI problems. You're getting endoscopy. You know, you're going to wonder why all these problems are happening. And then nothing is, because you can't chew all these tough foods, you're going to a more softer diet, which is primarily carbohydrates. So now your blood sugar goes up because they got diabetes.
Interesting. Good.
You know, and so that affects your glucose levels, and we can fix that. We can remedy that. We can get you chewing again. It's quality of life here, Randy.
What are the age ranges of people getting dental implants, by the way? How old can you be?
You know, you can. We've done implants patients over 80.
But why would an 80-year-old want dental implants, though, or to go through that? And are they too old?
No, there's no real old or too bad. It's medical considerations, of course. You know, if they're healthy enough to have, if they walk into my practice, they're healthy enough for those implants. We don't really consider age in there. It just takes, we consider the health of the patient. And most people are healthy and controlled with whatever ailments they have. They've been seeing their physician and they're controlled with those ailments. For the most part, implants are right for anybody at any age.
So what are the different categories of dental implant patients that you see?
There's primarily 4 categories. You know, missing one tooth. That's very common. Either existing one tooth, or they're about to have a tooth taken out because it's hopeless, or they had an accident and they had one tooth break. That becomes a cosmetic issue right in front. And we replace that one tooth with a single implant. Very easy. We take that tooth out, put an implant at the same time.
Why is that better than traditional dentistry?
Okay, let's
doing
compare
a dental implant over
a bridge,
or, yes.
for example. Okay, now with that one tooth, it's a one tooth problem. Okay, for starters. When you do a bridge, you've got a 3-tooth problem down the road somewhere, because with wear and tear, it's going to be replaced.
So how long does a bridge last?
10 to 15 is an industry standard. It could be longer.
Okay.
It could be, you know, it could be shorter. Depends on maintenance of that bridge. And there are other factors, your bite, how much force is on those.
But a dental implant's like getting your tooth back. So you can
exactly. It's a single tooth. Okay, with a bridge, you know, there are 3 teeth joined together. You can't floss between them. With an implant, you can floss. It just feels like your own teeth. My assistant, we did an implant on her first thing in the morning. Boom, got done in 20 minutes.
All right.
She went
painful. Must be painful.
0.
Really? Okay.
Later on in the day, a little bit of gum discomfort. It's kind of like eating a hot pizza. You get a little burn. The next day it's gone.
Okay.
That's it. In fact, we prescribe medication for people to take pain. Take it anywhere. Anyway, because I don't want you to have any surprises. I want you to be comfortable. And half of those patients don't take it.
So pain is not something they complain about?
That's not an issue. That's a concern. That's one of the first questions anybody would ask. Does it hurt? I mean, it sounds painful, doesn't it?
Because the bone.
Yeah, we're drilling in the bone, so it sounds painful. I know, I get it. And until I saw it, I would have said the same thing. It sounds painful. But as many as we've done, and we've tracked those patients, we call them that night, we call them the next day and say, how are you doing? I'm fine. Yeah, a little gum soreness, but, you know, nothing that you can't deal with.
So why is it what used to take dentists, say 9 months to do dental implants, to complete the process, now can happen in a few visits? What's changed?
Oh, a lot has changed. I mean, this. Do you have a few hours?
Yeah.
Okay. We would go on about this. You know, we got shape of the implants, the surface of the implants, the screw, the pitch between the screws. There's a whole bunch of factors that's involved in this. Over the years, they've done a lot of research to see what it is that would make integration. By integration, I mean fusion of bone to implant.
So the bone grabs onto these implants faster.
And here's the analogy I like to use with my patients a lot. You know, in the past it used to be the lower jaw 4 months, upper jaw 6 months, because the quality of the bone is different, upper and lower jaw. It's kind of, you're looking at styrofoam on the top versus oak on the bottom. The tougher the bone, the better the integration. You know, so now if you're going to build a building, you put the foundation on, you put the concrete. You got to wait for the concrete to set before you can proceed with the rest of the building. That's the same thing. Our concrete takes that long to set. But with advances in dental, with research and implant technology, manufacturing, it's shortened that time tremendously towards, in many cases, we can load the same day.
Same day.
Yeah.
Same day dental implant.
Patient comes in with an existing denture. Okay. We've done the preparatory work. We've placed the implants, 2 or 4, and we engage with implants. When they leave, they're already doing better. They can go and have lunch. They can have a steak. And I'm not talking blended in a blender.
Is that
They can go
right?
and eat it and be fine. Another thing that's changed, which is factoring big into this whole same day, we know beforehand what we're dealing with because of imaging. We do a CT scan. It's a 3D image of the patient's jaw. It's a virtual jaw that I have on my computer. I know the quality of the bone, as in, is it styrofoam, is it oak? How much bone there is, what are the vital structures there, where I want to play. So I do a virtual surgery on the computer. And I put the implant where I want it to be optimal, and then I send that information. I email it to the company that makes the software, and they make me a guide with holes on where I want the.
So a guide just goes in their mouth and you.
Exactly. At the time I don't even want to call it surgery because it's so easy. You know, you put it in there. I can close my eyes at this point and just do it in 10 seconds.
You told me that on the phone. You said I can almost close my eyes nowadays.
Yeah.
Is that right? And that's why there's less pain. Now, and correct me if I'm wrong.
Absolutely.
Because you're not having to open up the gums as much.
In the past, it used to be that
Now
you cut open the gums, you peel it back because you want to see the bone, and then see where you go. And it's still in 2 dimensions until you get in there. You want to make sure that you don't want to hit any vital structures, and it's touch and go. It takes longer because you're going slow. You take another x-ray and you want to see where you are. With this, because you know beforehand, you've done your blueprints, so you know beforehand, you know where the vital structures are.
Is this one of those things where it's all done and they've got like a denture, or it's secured by dental implants?
Yeah.
Do they say I should have done this years ago?
Absolutely, all the time. And I wish they would have done it years ago, because they would have had more bone to work with. The more bone, the better positioning of the implant. The less bone you have, then it becomes a compromised situation. It doesn't mean we can do the implant, but we've probably got to augment another procedure or two. We've got to maybe put some bone grafts in there to add bone where they've lost the bone. You know, and that,
if it's so good, by the way,
yeah,
why isn't everybody doing it? So if you have over 1,000 in just, let's say in Hanford or in the Central Valley, thousands of people with upper lower dentures, why aren't they all doing it?
Well, primarily this is the patient population that has stopped going to the dentist because they have their denture. They don't have any teeth.
Point.
You know, they, in their minds is, I don't have any teeth, I don't need to go to the dentist.
So nobody's telling them to do it.
Exactly. They don't know that what's out there available because they haven't gone to the dentist and gotten that information. Also, look what's led up to that tooth loss. They've probably had a full mouth of teeth before, which went bad. You know, they had root canals, they had periodontal disease, and they've had all their teeth taken out. They're done with the dentist, so they think that's fine. You know, I'm resigned to a denture now. This is where I am. This is it. You know.
My father told me, I knew you were coming on the show, that he was glad to get his teeth out because they were so painful,
right,
etc. So I guess the last thing they want to do is go to a dentist.
Exactly. The thing is that paradigm shifted. You know, before, a dentist couldn't do any more for them, and so they were done. What are you going to do with a full denture and no teeth at the dentist before implants? Now we can offer them those implants. Like I said, with the imaging, the CT scanning, I use a laser, so I don't even know cutting, stitching, bleeding, none of that. I use a laser, just pop open, drop the implants in. Takes me about 10 minutes per implant, tops. Under an hour, we're done with 4.
We should mention, I mean, not all dentists do dental implants.
No.
And also the way it's normally done is they go to one, and correct me if I'm wrong, they normally go to one doctor, the surgeon that does the implant. Then they go to another doctor that does the tooth that goes on top of the implant. Is that correct?
Yeah, it's two different.
You do it under one roof. Is there an advantage to that?
Yes, there is. In a small town, the towns are segregated. There's quite a bit of a drive, and people don't want to drive that distance. They want to go somewhere else, especially if, you know, the dentistry the way it is. You find a dentist that you're comfortable with. You don't want to have to retread that, will I not like this dentist yet again. You're comfortable there. You'd like it to be done under that one roof. Nothing is the gasoline prices. People don't want to drive, you know, 20 miles up somewhere else.
But the denturers don't have a dentist, right? For the most part, I guess they go in for a reline or whoever made their denture.
They'll try a new dentist every once in 5-6 years and say, oh, it's kind of loose, or I have a sore, and that person will do something, and then you won't see them again for a long time.
You make dentures, though.
Yes, I hesitate because I see just dentures. I try not to unless I'm going to do an implant with that, because I see the benefit of that. You know, without the implants.
When you say implant with that means that you're putting implants like in their mouth.
Yeah, just two.
And securing this denture on those.
Exactly.
So you don't like to do traditional dentures.
Right, without any kind of retention. That's what the implant does. It holds on. You know, and I've got some models here to show you what that is.
Yeah.
The benefit of that. I know they're not going to be happy. You know, it's not the best thing there is. But with the implants, life changes tremendously. I mean, it's a whole different ball game completely. You know, and you won't know this until you know this. It's one of those things.
Are denture wearers, I mean, you know, I know a few denture wearers. I don't hear them complaining. Is there such thing as a happy denture wearer?
As human beings, we have tremendous adaptive capabilities. We will adapt to anything, anywhere. And that's one of those things. If you resign yourself to your situation, you're going to be happy primarily by not thinking about it as a problem. Okay, this is just the way it is, and so I'm going to deal with it. What else can I do? Nothing, so why complain? Kind of a thing. You know, we joke around when I see patients and they say, you know, how you doing? Well, no complaints because no one listens. Well, that's true. You know, they're not going to complain because they don't think anyone's going to listen to them. By all means, complain. If you're not happy with your denture, go into your dentist and complain. You know, because there is an alternative.
Now, I've seen, you know, on the internet, by the way.
Yeah.
If you Google dental implants, there are pictures or videos of people getting their dental implants, these denture wearers, and then they're biting out of apples.
Absolutely.
That's got to be dangerous, though. That's not something you recommend, though.
No. Let me show you on the model what a problem that is.
So let's take a look. Let's take a look. Okay.
Here's somebody that's wearing dentures. No implants. common problem. It's loose. It doesn't fit very good. You got to rely on adhesives. And that